are there so many different forms of medications? Why does a medication like we all know, like ibuprofen, come as a capsule and a tablet and an oral liquid? Why can't it just be one? And why do other medications come as patches and IVs and eye drops and all kinds of things? Hey there everybody, welcome back to another episode of Pharmacy for the People, where I try to put your health back into your hands by equipping you with the tools that you need to overcome the oppressive tyranny of medical complexity and cultural disillusionment that we face in our lives today. My name is James, I'm a licensed practicing pharmacist, and if you're new here, if you enjoy this video today and you find it helpful, consider sending it to somebody that you think would also find it helpful and subscribing to the channel. Okay, so why are there so many different forms of medications? Well, that is a great question. First, you should know that we call these different forms of medications dosage forms, and there are a lot of them out there. One medication might come in myriad different dosage forms. You may have seen tablets, capsules, oral liquids, like I mentioned, ointments, creams. Those are all very common for over-the-counter medications. Injectables, sublingual tablets, enemas, patches, inhalers are some of the ones that I see daily in the hospital, on top of the ones that I just mentioned that you might see in a regular pharmacy. Then there are also eye drops, ear drops, lotion, shampoos, topical aerosols, implants. The list keeps going on and on. Those shelves that you see behind the counter in the pharmacy are stuffed with all these different dosage forms. Not only do we have all these varied dosage forms, but the way or the method that you give a medication can be varied too. We call those routes of administration. So, if you take a capsule or a tablet orally, or if you give an injectable intravenously, you also have ocular for eye drops, topically, intramuscular, rectal, intraosseous, intraventricular, intrathecal, etc., etc. There's a lot of different ways that you can get a medication into a body. But the question still remains, why? The reason behind all this variety is mostly twofold: pharmacokinetics and marketing. Now, I don't like marketing, but I don't mean marketing in a completely nefarious sense here. What I mean is that some dosage forms are easier or preferable for people to take than others, which creates an opportunity in the market. And so people come out with different dosage forms to meet those preferences. Yes, a child can take a tablet or a capsule if they're capable of swallowing solids, but most of the time they're more likely to take an oral liquid because they prefer it, especially if it doesn't taste like a burning diaper omelet. And yes, the vast majority of humans have working rectums, but it's generally much more pleasant to take a tablet or a capsule than to use an enema or a suppository. So all I mean is that some preferences create an opportunity and a market, and so marketing is a reason that we have so much variety in medications. But the other part is pharmacokinetics, and this is the part that I'm far more interested in. Pharmacokinetics, if you've been following along in other videos, you'll remember that pharmacokinetics is the way that the body responds to a substance that's inside of it. It's absorption, distribution, metabolism, and then elimination from the body. When we're talking about different dosage forms or routes of administration, we're mostly talking about absorption and distribution of these medications. So that's getting the medication into the body and then getting it to the site where we need the action to take place. Because medications are so varied in their chemical makeup and our body responds in such a variety to different chemicals, it's necessary to have different dosage forms to get things where we need them. For instance, if you were to take a tablet by mouth down into your stomach, unless the site that needs the action is the stomach itself, the medication has to dissolve and be absorbed into your bloodstream to make it somewhere else in your body, like your brain, heart, or toes. Some medications are easily absorbed into your bloodstream and some are not. It all very much depends on the chemistry of the medication. If you took basic chemistry, you may remember the phrase like dissolves like. What that means is that things that are similar to water chemically are more easily absorbed into water. Things that are more chemically like an oil are more absorbed into an oil. A medication that easily dissolves in water that you might drink with the medication when you take it, or in the acid that's in your stomach when it gets there, is easily absorbed into the bloodstream, rides the bloody seas all over your body, and deposits into the tissues. just like sugar does when you suck a Reese's peanut butter puck down your throat. But some medications are not easily absorbed when taken by mouth. These medications might need a different dosage form or a different route of administration to get where we need them. Otherwise, they won't be able to do the thing that we need them to do. They'll just be in our body floating around and then they'll leave. For example, vancomycin is an antibiotic that's commonly used to treat methicillin-resistant Staphylococcus aureus infections, or MRSA for short. Well, vancomycin's structure chemically is very large, which means that it's not able to easily get through or around the cells needed to get into the bloodstream. So if you were to take vancomycin by mouth, it would not go into your bloodstream. It would just stay in your GI tract and then come out the other side. Now, if you had an infection in your GI tract, which does happen, it could treat that. It could help treat that, depending on what's causing the infection. But if you needed to treat a MRSA infection in your bones or your skin or your bloodstream, you can't take it by mouth and expect it to work. You have to get it in there either intravenously, directly into the vein, or some other creative way to get it into the bloodstream. Another example is medication delivered through patches. Your skin is very hydrophobic, which means it does not absorb water very well. Hydro, water, phobic, fear of. It doesn't absorb water very well. That's why you can stick your hand in water or sit in the bath for a while and it takes a while for you to get pruny. Or why sitting in a pool for a while doesn't change the chemistry of your whole body, because that water does not easily absorb into your body. So if you were to try to administer a medication that is very much like water on a patch, it would probably just sit on the skin and not go anywhere. It wouldn't get to where we need it to go or do the thing we need it to do. So if you're going to use a patch to deliver a medication, typically it also has to be hydrophobic, has to be like your skin. Remember, like dissolves like. So a very hydrophobic medication can more easily pass through your skin into your bloodstream and get where you need it to go. In some situations, you're able to get the medication into your bloodstream, but you can't get it back out of the bloodstream to the site where you need it. Some tissues are very difficult to penetrate with different things. For instance, your eyes and your joints. They're both surrounded by a very fibrous material that makes it very difficult to get things into, despite the fact that they are in fact supplied by blood. That's why eye drops are typically the best way to get medication to the eye to treat diseases like an infection or glaucoma. Similarly, that's why you may see a physician give an injection directly into a joint to help treat things like arthritis or degenerative joint disease. It's because once the medication is in the bloodstream, it doesn't get into those tissues very easily from the bloodstream. Different route of administration. And the same thing is true for our brains, which is a good thing, right? There are lots and lots of blood vessels that are supplying glucose and oxygen to these nerves in our brain. But those blood vessels have special features on them that make up something called the blood-brain barrier. The blood-brain barrier keeps some things in these neuronal cells and some things out. This is to prevent toxicities from easily getting from your body into your brain. You can think of it like an organic border patrol. Your blood-brain barrier keeps certain things out of the brain, out of the cells of the brain. This is to help prevent toxicities that arrive in your body from making it to your brain and killing you very quickly. So treating something that's happening to the brain can be very challenging. The chemistry of the medication that you're trying to get there has to be very specific. Infections like bacterial meningitis, where bacteria gets into the fluid that surrounds your brain and causes a life-threatening inflammation to these meninges, these tissues that surround your brain, has to be treated with really specific antibiotics to make sure that it's able to get in past the blood-brain barrier to your brain quickly and at high enough concentrations to actually help kill the bacteria. Say instead of trying to get the medication somewhere deep inside of your body, you're trying to just do it in a really specific spot that you can see. You don't want it to go through the whole body systemically. You want it to be in a really localized situation. In that case, we might want something that's applied directly to the site. That's where creams, ointments, shampoos, and other topical administrations are so helpful. Say, for instance, you have a cut on your finger that you can see, and it's got an infection. You just want to apply an antibiotic ointment directly to that site. Or say a different cutaneous infection like ringworm is a fungal infection of the skin. You can treat it by applying an antifungal directly to the area that's been infected. Or lice. We all know about lice. Lice is an infestation of critters that are on your skin and your hair. Generally, you just need to apply a shampoo or something topically to kill these critters on the outside to get rid of them. Of course, there are exceptions to that, but topical administration of medication can be very useful, and that is why we need topical dosage forms. Still, in other cases, there might be something wrong with our bodies, our physiology in an acute setting that prevents us from using an oral medication at all. Or sometimes an oral medication just doesn't do the work fast enough and it doesn't get there when we need it. This is commonly the case in an emergent or a hospital situation. You need the medication now to prevent your body from falling apart. So we can use other dosage forms and other routes of administration to get the medication where we need it immediately. Say somebody has an unrelenting nausea and vomiting and they're throwing up all the time. Well, if you take something by mouth to try to help with that nausea and vomiting, chances are good you're going to see it again before it has a chance to actually help with what's going on inside your body. So using something that's a sublingual or a rectal suppository or an IV may be the best route of administration in those situations. Or sometimes there's an anatomical issue with your gut tract that prevents the reliable absorption of things into it. People who have had unfortunate circumstances in their lives, like a trauma or a disease that have caused portions of their GI tract to be removed to save their lives, it may disrupt the ability of the body to absorb medications into the bloodstream by the PO route, the oral route. So in those situations, giving something intravenously may be the only option. And that can include nutrition. People whose guts don't work, they have to use IV nutrition. In an emergency situation, in a life-threatening situation, sometimes you don't want to wait for a topical or an oral medication to dissolve to get to where we need it to go. Sometimes you need that medication at the site of the action immediately. It might take 15 or 20 minutes for this to become dissolve enough to get into your bloodstream. If your body is trying to die because your blood pressure drops and can't deliver the oxygen and nutrients that you need to your body, to your heart, to your brain, you may die waiting for an oral medication to get there. So an IV line may be the only way to keep you alive. Or worse, an intraosseous line. Intraosseous line it's like an IV, but it goes directly into the bone. That can get a life-saving medication where we need it, when we need it. Or think about pain. If you've been in a bad car accident and broken your leg, you're in horrible pain, popping a tablet and waiting 20 minutes patiently to see if it helps is probably not the best situation. You don't want to wait 20 minutes to make you feel like you're not licking a hot stove. You need something IV that will get into the bloodstream, into that area fast. So if you're walking through a pharmacy aisle looking at all of these medications thinking, my gosh, this is gratuitous. Or if you're watching a doctor drama on TV and they're using things in the muscle or quickly pushing them into an IV and you're thinking, wait, what are you doing? Why is that necessary? This is why. The answer is practicality and preference. We have to get a medication to where it needs to go, and that all depends on the circumstance we're in, the chemistry of the medication, and the timing that we need it to get there. So, I hope that gives you some intro into why all these different dosage forms and routes of administration exist and how we use them. Thank you so much for your time and attention today. Delicious. Please leave your comments and questions down, but that was not delicious. I was being sarcastic. Please leave your comments and your questions down below. I love hearing from you guys. If you enjoyed this video, let me know by liking and subscribing. Hopefully this gives you some resource for... If you enjoyed this video, let me know by liking and subscribing. Hopefully now you're just a little bit more equipped for dealing with those pesky drug questions that affect yourself and your family. Thank you for joining me, and power to the people. What that means is that things that are like water absorb water.